Hey Casey, Hector.
Good morning.
Today we have a special guest, and we're here at the beautiful Oxford Exchange again as always, and the opportunity and privilege that we have today is to do an interview with Dr. Afonso. And hey, how are you doing today?
Very good.
And first of all, what I'd like to say is it is Dr. Afonso, not Dr. Alfonso, which even though I knew her for a while, Afonso is a little different, right?
It is,
To
yeah.
not have the L in there? Do you
Yeah,
come across that a lot?
A lot, all
Okay.
the time. All the
So
time.
everybody will officially know her from the right name now, which is Dr. Afonso. And you know, Dr. Afonso is, she's joined the practice was it the beginning of August?
At the end of June was my first official week.
At the end of June, right.
Yeah, time's passed.
Yes, already. And she's fresh out of University of Florida Dental School, which is where I graduated from. And I like to say she was very well curated and handpicked, of course, by not only me, but with my staff. And this has been a long process, hasn't it?
Yeah, but it's been a wonderful process. I've loved it.
And we've known each other for a while, and I knew Dr. Afonso's mom. Mom said, yeah, you know, my daughter is interested in dental school. I'm like, you know, I hear these type of things a lot, and I always love to hear that, because as you've heard me say in the past, I just love when people want to get involved with dentistry. And for me, it's such a privilege to help somebody maybe enter this profession. But the unique privilege in this case is that she's actually practicing with me and joined my staff. And so what a neat opportunity to see somebody enjoy dentistry as much as we have, and she fits into the practice beautifully. And so, you know, after her mom told me about this, and then the next thing you know, Dr. Afonso is in dental school, and she worked with us as a dental assistant. And the thing we liked about that was she showed up on a regular basis. It's not like she just showed up and then, you know, we don't see her anymore. She showed up and she showed up again, and spring break would come around. She goes, you mind if I hang out in the office? I'm like, yeah, let's do it, you know. Christmas break, she'd show up again, and then finally we said, well, we got to start paying this person. She's working so hard. So we started paying her as a dental assistant, and like then, you know, our energies kind of gelled. And I'm thinking, my staff is actually saying, hey, she would really work out well as an associate. I'm like, yeah, you think so? And here we are. So we're going to give you the floor now. And, you know, I don't know, what do you want to tell us about yourself, that you get a background?
Yeah.
You know, tell us a little bit about yourself.
Okay. So I am from Tampa. I was originally born in New Jersey, but I have lived in Tampa my whole life. So I kind of call myself a Tampa girl. Love Tampa. Grew up, I went to Alonzo High School, which is funny because my last name sounds just like my high school, so that L is back in the game. Played soccer as I grew up in the community, and then I stayed in Tampa for undergrad. I went to USF. Loved it.
I did too, yeah.
Yeah. And then the great part, I went to UF for dental school, so I moved from Tampa to Gainesville, and I know you did too. So you're a Bull Gator, and I'm a Bull Gator.
Right.
So I love that connection. And now I'm back in Tampa, and I love it. I'm so happy to be back here, and I'm really enjoying my time now that I have graduated, and now I'm working as a dentist. It's great.
So it's been a while for me, but I mean, what are you experiencing right now as somebody who's thought about being a dentist for a long time and being out in the working world and as a professional versus when you were in dental school studying hard, cramming for tests, dreaming about what it would be like now? Is it as good as you thought so far, or is it better than you thought, or is it like, I don't know, I'm in the grind right now and I can't wait to get out of it? I mean, what's it like?
Definitely no grind. I'm enjoying it a lot. So the transition from having these goals and this idea of what it's going to be like, and going through dental school and starting to pick up more experiences with patients. Now that I'm seeing patients every day and interacting with you and them and the staff, it's been wonderful. It's more than I dreamed of, because I can understand the dentistry part because I learned that through dental school. But here, now that I'm actually practicing as a dentist, those interactions and the rewarding feeling of I've learned all this and I've gotten to this point and now I can provide a service to others, it's been a great transition from becoming a student to a dentist, and I've loved it.
Well, I know we didn't push you into coming in to work in the practice, and you had a lot of choices, right? But from your point of view, what is it about joining our practice that was appealing or intriguing or that interested you versus going out and working in the corporate world in dentistry or doing a GPR, something like that? Can you tell us a little bit about that thought process?
Yeah, absolutely. So I got to know your office before dental school, and you taught me a lot kind of getting in and preparing me. And I stayed in touch with you, and the main reason was I saw you, Dr. Saylor, as my mentor. You have this ability to teach, and we joke around sometimes that being with you and in the office is like my residency. So when making that decision about do I graduate and continue in my education with residencies or specialties, I decided to continue with you because I understood the way that you are as a teacher would benefit me, and the way that your practice is somewhere that I would learn a lot and experience a lot. So that's how I decided on that. And then deciding on your office specifically, because I had been exposed to your office and worked there, I knew I loved the staff. I loved the environment that you guys had there, and that was the difference between going somewhere else or even corporate. I didn't think I would get that same friendly family environment. I tell people, kind of like I came home when I finished dental school to your office, is going back to something I knew that I was going to enjoy because I had enjoyed working there already.
So, like when you say that environment, you know, from a patient's point of view, they're thinking, gee, environment, it doesn't seem that fun going to the dental office. How would you explain it from a patient's point of view?
Yeah, so the way that you come in, everyone is so kind and friendly, and so it's a very welcoming environment is how I would present it. And then the way that the office has our philosophies, it just feels like you're doing good, and it makes you really happy to come to work. And so that's that environment from my perspective, that the patient might see a snippet of that, where we have that appointment with them and we talk to them, and we're always focusing on what's best for the patient, but we do that for everybody, and it's such a great culture to be a part of that I get to really enjoy and learn from.
Yeah, well, that's really well said, as far as always focusing on what's best for the patient. And you know, a lot of times we sit the patient down and it's like, you know, we ask ourselves what's in it for the patient, and that's really why they're there, right? Is if they're going to sit down and spend the time and money and the stress of going through a crown appointment or a root canal appointment, it's like they have to know what's in it for them, right? Why they would be doing that. So what do you see yourself, what kind of goals do you have for yourself in dentistry in the next 5 years? How would you like to grow? What kind of goals do you have for that?
So I have the goal of continuing my education, because I've made a decision to start practicing and learning from you, but there are the continuing education courses and institutes, and so diving in and learning the more advanced dentistry so I can be a better clinician, so I can provide more comprehensive dentistry. So growing as, with my knowledge, growing as a provider, absolutely within the next 5 years, I hope to learn a lot and dive in, because I think dentistry changes so much, and right now we're going to digital dentistry, so I really want to start going into stuff like that. And I know I love dentistry, so I'm going to be happy no matter what I do if I continue this career. The next 5 years, I'm sure I'm going to be just as happy or more happy. But it's that learning opportunity I really liked about dentistry, so that's going to be one of the main goals. And of course, growing in your practice, getting to know more people, and growing my patient pool, and being more of a part of the community, which is also an aspect I really love about dentistry, the community aspect of it.
So as far as you hinted towards this a little bit, but the things that are coming down the pipe in dentistry, there's a lot. It changes so fast compared to when I came out. What do you think's coming down the road that you really feel like you want to master and take on, that's going to be, as we always say, the biggest benefit for patient care?
I think the biggest benefit is going to be that digital dentistry. Moving past analog, which in normal terms is that ooey gooey impression, the way that we used to do things, and then it opens up a new world with digital dentistry, because it's going to be more comfortable for the patient, scanning versus those ooey gooey impressions, planning, communicating with specialists. So that I think is going to be where the future of dentistry goes, and that applies to so much of dentistry. It applies to crowns, it applies to dentures, it applies to cosmetic dentistry.
Yeah.
So it opens up a lot of doors for myself and for the patients.
Well, it would open up a lot of doors for me too, because I'm kind of old school and it's something I dabble in, but let's make sure you learn that, because
Yes, please.
the digital dentistry is a big, big part. And as you know, I've got my feet in it, but you know, with being younger and your aptitude for that, that'd be fantastic for our patient base if you can bring that to the table. So, you know, when you wake up in the morning and you think about your day, right now, what really drives you? What do you look forward to in a day as a dentist?
So it's the culture you have at your office makes me really happy to come to work every day. So when I wake up in the morning and I know I'm coming to work and be a dentist, it's being able to interact with the patients. And that's something that no one can take that away from you, because you have these personal interactions with everybody. And me, as somebody new that they've never seen before, I really get to know them, and I love seeing when someone who sees me as a stranger starts opening up and we start talking and getting to know each other, and I can see that we're building the rapport and the trust, and that's something I really, really love. And I knew I was going to love that coming into dentistry.
And having gone through it myself, it's pretty difficult, isn't it? I mean, because first of all, it can be there's a lot of trust that goes into that from the patient point of view. And it's a difficult transition for me because we've worked so hard to build these loyalties with patients and this trust. And I think at least why you've been so well received is because patients do trust me. They do trust our staff. And when they know that I'm putting them in your hands, they're kind of looking at me and saying, I trust you. And I mean, you've done that really well. So it's a very difficult transition, but it feels right, doesn't it?
It does.
Yeah, it feels really right, and it hasn't happened by accident. So, you know, as we're introducing you to my family, it feels, I'm very confident in doing that, and the patients have received you so well because of a lot of the things that we say. So, you know, outside of the dental world, tell us a little bit more about how do you like spending your time? I mean, patients know pretty much a lot about my background, but what gets you going? I mean, what other passions do you have? Tell us a little bit more about personal stuff, if you don't mind.
Yeah, absolutely. So the things that I really enjoy outside of dentistry, which is a passion, is painting and drawing and getting into that artistic. I have a very artistic side to me that I've always enjoyed. I have sketchbooks where you can see my very rusty doodles and then how I've transformed throughout the years and improved those skills. And I love it. It's a really relaxing thing for me to do. I draw inspiration from anything, and then I really like doing something and giving it to somebody else. So friends and family, a little piece of art or something that I know maybe I have a friend who moved into a new home, and I made her something so she can hang up and have a little decoration. And just sharing that and then enjoying the process of making that kind of art is something I really like to do, and it's a hobby and a personal passion of mine. And then music, I love music. I love almost anything. I kind of grew up with certain radio stations where my mom would take me to school, and so I'd listen to all sorts of classics, and then I have the music that's out now. So I will listen to anything, and I'm really good with lyrics, which I love. Don't ask me the name of the song. I wish I knew the names of the songs and the artists, but I can sing you the lyrics.
Oh, really?
Yeah, I'm really I have an ear for that.
That's
for
funny
some reason.
Because I can't. And I love music too, as you know, but I always say I wish that we had the words up so that I could sing them. And well, that works out great because you probably learned a lot of new music since you've been in the office, since we have such a huge vocabulary of music. So that is a natural thing as well. See, I'm learning all kind of things as well. But you know, with this the art, I mean, has that been something you've been into as a child? And so how neat is it now that truly dentistry is art and science, right?
Yeah.
I mean, it really is, especially the way that we practice it. Is you can truly express yourself artistically with dentistry, can't you?
Yeah, absolutely. And that eye for detail that And then
Yeah.
I don't get stressed when you're taking a moment and trying to put a piece of art together, which is a lot of dentistry. You're taking the time, curating, making something try to look natural, and so it's a process that I enjoy a lot.
Yeah, and you'll have a lot of opportunity to hone that even more, but we can see in your work that you have that artistic flair, which is nice. And I don't know, it seems like you kind of have that or you don't, you know, and if you don't have that, you kind of, you could still do dentistry, but you may not get that satisfaction as much from that completed work as Hector was saying. When you do something and it smiles, you know, it's like you're in harmony with the total result of what the intention you put in and what you get out, and when it smiles back at you, makes you smile on the inside. So as far as living in Tampa as a doctor now and getting established, I think you're living at home right now, right?
I am, yeah.
So what are your plans for the community and to be active in the community or whatnot? How do you plan on, what do you think about with that?
So networking. So Tampa is a wonderful community of all ages and all backgrounds, and so there's many networking opportunities to get to know different people and different organizations. So getting out there and also looking into service opportunities. I love giving back and serving the community and volunteering. I did a lot of that during dental school. So finding those opportunities around Tampa and going into the community in that sense.
Yeah, so you meet a lot of people on a regular basis now, and I'm sure they ask you dental questions and whatnot. How do you tell them in so many words why they should come to you as a dentist? That's a tough one.
That's a tough one. That's a tough one because I am right out of school.
Yeah.
So I have learned so much, but I'm still growing as a professional and as a dentist. So to have someone and have that conversation of, you know, you should come here and come see me, it's not an easy conversation.
Yeah.
So
but from your heart, what would you say?
I would tell them, you know, we have an amazing office with experienced staff, and we have philosophies that is patient-centered. And everything I've learned, it's to try to provide a comprehensive dentistry and the best care possible, and my own personality and that my own qualities that go towards being a dentist. I'm a great listener, I'm very patient-centered, and I try to communicate as much as possible. So I would tell someone that if you have any anxiety, if you have any concerns about coming in to see the dentist, that I would be someone who would listen to those concerns and try to address them and help as much as I can using the qualities and all the knowledge that I've learned.
Yeah, and I think that's really well said, and that really goes along with our philosophy, which is, you know, I think that requires time, right? Requires time. It requires the intention of wanting to do that in the first place, and then it being an environment where it's not so much pushing people through and seeing as many patients as you can in the day, but dealing with the individuals in the chair and feeling like you have the time to devote to that individual and to truly help them, which is first finding out about them and really wanting, I mean, you have to like people in dentistry, don't you?
Yeah, you really do.
Yeah, it's like if you love dentistry but you don't really like working with people, it's not going to last very long, you know. Or if you love people but you don't actually love doing the procedures, that's the opposite of that as well. So you have a couple of questions on here too that I want to cover, because these are all things that I was thinking about, but you had some pretty good ones. So as far as, why did you decide to pursue dentistry, and when was that?
I wanted to be a dentist since middle school. I kind of figured it out at a younger age because I knew I wanted to do something involving helping people in need. I wanted to be around people. And I looked into the healthcare field. And so I was making decisions on what career I was actually going to do, and a big part of that was going into offices. So very early on, middle school, I knew something in the healthcare field, and I leaned towards dentistry. And I remember specifically middle school because there was an assignment that you had to present on the career you were interested in. I presented on dentistry.
Oh, wow.
And everyone's response was, ew, you
Yeah.
want to work in people's mouths?
You want to work in people's mouths.
Exactly,
Right?
yeah. So that stuck with me, but it didn't stop me at all.
Uh-huh.
I continued that interest through high school. At the end of high school and through college is when I went into those offices, really figuring out, is this something I want to do? Do I see myself doing this?
Mm-hmm.
And the dentist offices, the dental offices were so open and welcome to having me come in and observe your
Yeah.
office as
Right.
well. And so I got to learn about the profession and see myself doing it. And the turning point for me where I solidified that decision, I was like, yeah, this is what I want to do, is as I was observing and seeing patients come in with dental pain or concerns, and the dentist giving opportunities and solutions and options that same day,
Mm-hmm.
and that turnover of someone coming in with pain or problems and having some of that resolved
Mm-hmm.
at the end of the appointment
Right.
was amazing.
True.
That same day solutions and how that helps the patient. So that ability to make such an impactful change quickly
Yeah.
with somebody, that was one of the main reasons I was like, yeah, I want to be a dentist.
Right, and especially when somebody's coming in pain and you have the ability to help them,
Mm-hmm.
it's a pretty significant role in their life at that point. And as far as another good question that you had here was, and this is a tough one and kind of personal, but right, share an important or meaningful experience that you've had.
So a very meaningful experience that I've had was through dental school. I volunteered a lot, and I got involved with a free clinic that would provide care once a month on Saturdays. And in that environment with that organization, I got to meet many people in need who didn't have the opportunity to see a dentist. So we had a particular young woman who was in her early teens who was in severe dental pain, and she had a lot going on, and we were able to connect her with the dental school and give her the care that she needed. And the gratitude and how happy it made those patients to have somebody be able to sit down, talk with them, understand the problems, and say, okay, let's get you some help. And that was so rewarding, and it was very impactful for me, because going back to the dental school, I saw that patient in the hallway as she was going to the pediatric part of the school, and she said hi to me. She remembered me.
Mm-hmm.
And I love that, because I could see she was happier. She wasn't as stressed. Her mom was with her. Her mom was so happy and less stressed.
Right.
And seeing that change of being able to be a helpful person to them and point them in the direction of getting their dental needs met was really important and impactful. And through my volunteer experience, I met a lot of people like that just talking with them and helping them. We provided dental care at those clinics, so providing the care that they needed, even if it was just very limited because it was a free clinic. It was so rewarding, and every patient that we saw was so nice and grateful at the end.
And now you have the opportunity to do that all day long.
Yeah, absolutely.
Yes. And how has your view of the dental profession changed from when you started as a pre-dental student to now?
So I did the observations in offices, so I had an idea of what a dentist does. But now I see how amazing this profession is to be a dentist and be able to grow. There's so many opportunities, and you can choose what you want to do. You can curate your practice and your clinical skills to be able to provide what you really enjoy doing or what you're really good at. And that's something I didn't know, but now that I understand that, I have these opportunities, which connects to going into those courses, continued education, and learning. It's just opens the door and makes me really excited for my future in dentistry.
Right, because it's like a playground. I mean, you can, as a general dentist, you can choose to do root canals, you can choose to do ortho,
Yep.
you can choose to do crown and bridge or implants. And it really just depends on you as an individual, what excites you and what you feel that you have the aptitude for, and where you want to put the time in. So right now, what procedure are you enjoying a lot?
I'm enjoying a lot of crown and bridge work. So the ability to have a tooth that needs a crown, for example, and it's that artistic side where you have to be very detailed oriented when you're trying to prepare a tooth for a crown. And then being able to eventually get that crown back and have it almost look like nothing was done.
All right.
That's the stuff that I really enjoy. And so that's kind of my goals of building up my skill, which is kind of a funny way to think of it, but I want to build up my skill to the point where you can't tell what dentistry I've done, that it looks so natural and and flows with the patient's existing smile and teeth. And so building that, I really enjoy that.
And we know that's easier said than done, because it's something I still struggle with now. It's like, if we put the restoration in and it disappears, how good does that feel?
That feels amazing.
Yeah,
that's the goal.
and you know, a lot of times we joke and we say, oh, it looks like a tooth. We kind of mean it, right? It's like, it does look like a tooth. Sometimes it doesn't.
But that's the goal. Make it look like a tooth. Make it look natural. And I love that.
So we'll finish up with the last question, and that would be, what is the most challenging thing that you come across every day that really challenges you, and that you look forward to being able to look back at and say, man, I remember I was once challenged by that, but now I feel like I have mastery over that. What would that be?
Another hard question, because as I start out in my career, there's a lot that we learn in dental school, but there's so much for me still to learn and experience. So I think that challenging part of coming in is when we have those more challenging cases, and let's say someone comes in for an emergency and you have to figure out what's going on and what their treatment needs are. That is where I want to start excelling, and that's that challenge, because I'm a very detailed oriented and I love to be prepared. So when we have the schedule, we know what's going on. We know we're going to do this here and that here, but when something happens, which happens a lot, patients come in, something is hurting, or maybe a tooth broke, and that is that challenge where I don't have any preparation in the sense of like knowing what they're going to come in with.
Right.
So being able to analyze, diagnose, and then treatment plan is that challenging aspect, which I'm doing very well in it, but I want to continue and get better, and that's that aspect, because you can't prepare for that. You have that knowledge and that background. Okay, if I see this is the diagnosis, stuff like that. But not knowing what people might come in with for those limited exams is what we call it.
Right.
Yeah.
And so, just to kind of paraphrase, I mean, from a patient's point of view, and I know exactly what you're saying, because that would be very overwhelming somewhat, is, you know, the traditional way that a patient will interact with the dentist as a new patient a lot of time would be in pain. And on the patient's mind, it's like, I'm going to go to the dentist, I'm going to get this fixed. From our point of view, it's kind of like, yes, we want to fix that, but we want to see how this is going to fit into the whole, correct? And how what we're going to do is going to fit into the other issues, because you see the other issues sometimes right away, but it's not the appropriate time to address those issues, because that patient can't get beyond the original issue that they came in with. And so what Dr. Afonso is saying, in dental school, it's kind of hard to focus on the big picture in how to do what we say, which is, how are we going to get that patient to 100 with all their teeth? And there's so many steps, and that patient has made a good step by coming into the office, but sometimes we have to get them into the mindset of, let's think about what's next. And you don't address it then, but that's what you're thinking when they're in there, is I see so many other things that need to be put into place, and it's like, it's overwhelming with trying to deal with the immediate issue, but also planting the seeds for down the road. So I think that really helps patients understand a little bit more about you. I think you're a really well thought out person, very conscientious, and there's a lot of similarities that we have, which is why we work so well together. And it's so exciting being so early on in the relationship. But I look forward to look back at this and seeing how you grow through the years to come.